Aloha guys, Dr. Thomas back at you once again, continuing our discussion of cancer, one of the sad things that exists in our world. Okay, we left off right here. We went over the differences between malignant and benign. Now, some benign tumors also have to be removed, guys. Like there are brain tumors, for example, that start getting in and pressing on neural tissue and stuff. So they won't necessarily kill you as much, but sometimes they require significant treatment too. Characteristics of tumors. Muscle cell, this all looks pretty normal. Let's see, what is it saying here? Here, and particularly here, guys, looks like pepperoni pizza. These are tumors. One of the problems with the cancer is that the tumor is also a non-functioning tissue. It takes up space and gobbles down energy, but it doesn't do anything. Well, actually, there's some exceptions to that. Okay, what causes cancer? Carcinogenesis, transformation of a normal cell to a cancerous one, damage in genetic material. Well, some of it's due to DNA, mitosis, protein synthesis. Let's see, wait a minute. Genes of mutation. Oh, apoptosis. Yeah. Environmental agents, guys, can be a big one, and I think that's a lot of it. Chemical carcinogens, chemicals that are in water and so forth that can cause it. Radiation, sunlight, for example, but also nuclear radiation, if you're around it, can definitely cause cancer. There are some viruses that do. Oncogenes. RAS oncogene is linked to colon cancer, MYC to lymphoma, etc. Heredity. There's a strong hereditary component, guys, for cancer. It runs heavily on my mother's side of the family, unfortunately. Some of it we don't know. I think a lot of it's just, well, even the experts say, guys, a lot of it's just lifestyle related. A vast majority of the cancers have, if they're not entirely lifestyle related, they have an important lifestyle component to them. What do I mean? Overeating, eating a bunch of crap, eating 3 heavy meals a day of junk, too many carbohydrates, no exercise, stressed out, that kind of thing. Heavy drinking, smoking, heavy drug use, the whole bit. My personal opinion, and we'll keep going, I've been in health a long time. I think the worst thing you can do is to eat 3 big, heavy meals a day in and day out, week in, week out, year in and year out. That will get you. You can go a long time before it does, but you get in the middle age. Okay, these are genes. You can look at this yourself, guys, but it just shows genes for certain cancers and where they're found on the chromosome. Classification of cancerous tumors. Carcinomas, we mentioned that, of epithelial origin, make up 90% of all cancers. Breast cancer, cervical cancer, prostate cancer, lung cancer, are all carcinomas. Colon cancer, all the big ones. Carcinomas in epithelial tissue. And it just gives the more precise name for it. You don't have to know that stuff, guys, but have a feel for the general stuff about it. Sarcomas, we mentioned it just a bit ago, are of connective tissue origin. They make up 5%. For example, the most common primary bone cancer, because there's a lot of cancers that spread to the bone, like breast and prostate and stuff. But primary means it formed there. Is Osteosarcoma. No, I got it wrong now. I just got through studying it today too. Anyway, let's just keep rolling. I'm tired, guys. I've been doing a lot of extra work. A lot. Here's another table. Osteosarcoma. It occurs in children, unfortunately, and it tends to get in the leg. But it is the leading bone cancer. And it's a sarcoma. I'm sorry. I've been doing a great deal of study, and I'm tired. And I'm trying to crank off 6 of these videos the day before they're due. Guys, let me mention something about these videos. Most people really like them. I've done over 80 of them since I started doing them last year. I am not required to do these videos. This was my idea. I was the first instructor at HMC started doing videos. Why? Because I teach online. And the best thing we can do next to having you in class is for me to do what I'm doing right now. I've been criticized. Most people, 99% of the students love them. But occasionally someone will say, all he does is just sit there and read them. No, that's not all I do, and you should be able to see the difference in that. I don't just sit there and say, mixed tissue tumors, tissues capable of differentiating into epithelial and connective tissue. I do it a lot differently than that. And I don't have to do this, guys. I'm doing this on my own, okay? Because I think it's valuable. And another thing is criticized, they're only 15 minutes long. Guys, if you knew how much trouble I had to get some students to do anything, if I had a 2-hour video, you think you're going to watch it? I just make more. I like this one. It's going to take 2 videos to cover 54 power slides. All right. Yeah, maybe I'm grumbling a little bit, but we need to get to understand that. This is on my time, man. I'm doing this for you. I'm not required to do it by the bosses. I don't get paid to do it. Okay, kidney Wilms tumor. This is a embryonic in children. It's a mixed tissue tumor, teratoma. I think that's in. You guys are studying that right now in the DQs. It's horrible stuff. Pathological descriptions. Let's see. Cystic, fumigating, inflammatory, medullary, necrotic, polypoid, ulcerating, varicose. And we don't have time, guys, on this to go into the way they have all this on here. I'm sorry. That's another thing I was criticized for. But look, at the very least, I tell you what to study, what not to study, and you hear me pronounce the word. So you know how to pronounce it. Alveolar. Carcinoma in situ. It's not situ, it's situ. So it's worth something. If you don't like it, don't watch them. Just read the regular PowerPoint then, man. Do it yourself. You don't have to sit here and be bored by this old man. But don't hit me too hard, because I won't put up with too much of it. I work too hard. Okay, I better not say any more. Grading and staging of tumors. Degree of maturity or differentiation under the microscope. Stage, extent of spread in the body. That's a pretty complex thing, guys, that the oncologists take care of. International staging system for lung cancer. Details in pathology. So it's got, like, if there's no lymph node involvement, it's an NO. If it's ipsilateral, which means on the same side as the tumor, let's say it's on the right, then it's an N1. If it's on the ipsilateral mediastinal nodes or ligaments involved, then it's an N2. So see, guys, and then here's the metastasis. If there's no metastasis, which would be heavenly sent, it's an MO, and etc. You guys don't have to know this, but have a bit of understanding of it, like I do. You know, I know how to read it, I know what it means, but I don't have it memorized. Cancer treatment surgery, debulking procedure, may be used to remove as much of the primary tumor mass as possible. They'll go in there and use surgical techniques, guys, to try to remove it. Adjuvant, assisting radiation or chemotherapy after removal of primary tumor to prevent reoccurrence. The problem is, guys, the surgery doesn't get it all, particularly if it's metastasized. We're talking about millions and millions or billions of cells. So, depending on the type of cancer it is, the doctors will usually recommend chemotherapy, radiation, or both to try to get it all. They never get it all, but they try. But apparently, if they can get most of it, a lot of times the body can take over from there and destroy enough of it that they survive. Cauterization is burning. Or needle biopsy, you know what a biopsy is, taking a sample. Cryosurgery is using cold. I don't know what end blockers say, some sort of surgery, incisional biopsy, fine needle aspirate. It's where they suck something out with a needle. These are, it says surgery, and it is, but these are all biopsies. Now, do we know what a biopsy is? It's obtaining a sample to send to the pathology lab for them to identify what it is. Because they don't know until the experts look at it. Okay? Cancer treatment, radiology, radiation oncology. Brachytherapy is where they put the radiation inside you to keep working. But they have electron beams and external beams. Linear accelerated photon therapy, proton therapy. What's the difference between a photon and a proton? A photon's a particle of light discovered by Albert Einstein. Before then, according to Isaac Newton, they thought light was waves. In fact, they can be waves, but they're also particles. Einstein was the first to more or less prove that, one of my great heroes. Proton therapy, radio-curable tumors, one that responds well to therapy. Radio resistance, one that doesn't. Of the two guys, I've had a number of friends and family members close who went through all this, and I've watched it. And the radiation is the worst, in my opinion, far worse than chemo. Chemo was bad when before they could deal with the nausea and projectile vomiting across the room. But now they can take care of that. The radiation is stuff that shows up down the road a year or two later. Radiation therapy side effects: hair loss, fibrosis. It scars, guys. It forms fiber. It can make you infertile by destroying the spermatogenesis process or your eggs. Mucositis, mucous membranes. Myelosuppression, it can destroy the bone marrow. In fact, enough of it will. Nausea and vomiting. Pneumonitis, inflammation of the lungs. Secondary tumors. In other words, guys, radiation and possibly chemotherapy can actually cause cancer. So that's what that is. Xerostomy is dryness of the mouth. I've known some people. I had a patient one time who had cancer in here and had that taken out, and they destroyed his salivary glands with the treatment. So he had to chew a special kind of gum all the time to keep his mouth moist. Of course, it cost him his salivary glands, but hopefully it saved his life. So chemotherapy, biological therapy, and differentiating agents. Let's see. Alkylating agents, antibiotics, antimetabolites, antimitotics, hormonal agents. Just different stuff they use for cancer, guys. They're covering a lot of stuff here. Far more than we've got time to talk about. But we can hit the highlights, and you can go back over it, watch it again, or you can go on to class and read, however you want to do. You'll also get this again in patho. We put a lot of work into, mainly Dr. Y, but I and a couple of instructors helped to make this stuff match where you had the same stuff in both classes each week, which is good. It's like getting an extra study session, see. We did all last year. That's why some of it's still a little bit disorganized. Detect or treat malignancy, bone marrow biopsy, bone marrow stem cell transplant, CAT scans, colonoscopy in the GI tract, exfoliative cytology. I don't know what that other than just the broad term. Laparoscopics, where they go in the abdominal area with a scope. Mammography, we know what that is, x-ray of the breast. MRI, needle biopsy, radionucleotide scans, ultrasound, and x-rays. X-rays are great, guys, but they don't show a lot of what we need to see. They've been around 100 and something years. They're great, but there's a good screening tool and good for a lot of things, but they don't show soft tissues. Now, guys, let me clear something else up, because I had this came up too. A student was complaining because I was complaining about some of this and saying, now, if I had my way, I wouldn't have put some of this up there. And that's true, I wouldn't. Why? We need to learn the basic stuff first, guys, before we even think about advanced stuff that you're not going to see unless you work in a specific field. However, I'm not bitching and complaining about the book, or I'm just telling you how I would do it if I had a choice. I don't make the PowerPoints. I don't want to make the PowerPoints. It's a lot of work. I'd be more cranky than I am right now. But I will say, for your own good, I'm just telling you, I could just be hardcore and say, you need to learn everything on here, every single thing. Every one of these terms, you need to know every single one. Or would you rather me try to be your pal and say, okay, now, guys, you dig how I come with you with this? All right, let's not see any more of that nonsense. It pisses me off, just to be honest with you. Biopsy, CA cancer, chemo, no, that's not cerebral spinal fluid. All right, that's enough of that. You'll see that this is stuff that an oncologist would know, and probably I'm a chiropractic doctor, an MD would probably know some of these a little better than I do, maybe. But I've been teaching this stuff a long time too, so who knows? Erythropoietin, we all know what that is, right? Stimulates red cell production from the kidney. Actually, in MedTerm 1, I went through these and I eliminated a bunch of them. But I wasn't given the opportunity to work on the MedTerm 2. I don't know who did. So I would have taken a bunch of these out. But in the meantime, hey, if that hurts your feelings, learn every one of them. Just learn them all, man. Just go for it, yeah. Mets or metastasis, that's an important term. Pap smear, we all know what that is, right? The reason they call it pap smears, why? We're almost out of time. All right, guys. See you next time.